Welcome to the podcast show for the Nurse Practitioner Association, New York State. We will discuss everything from advocacy, legislation, to resources that you can really access at your fingertips, to helping you grow and thrive in the healthcare industry. Our new podcast will feature a new guest every 2 weeks focused on relevant industry news and topics. Today's guest is Dr. Denis Tarrant. Yes, let me give our listeners a bit of background on who you are. Dr. Denis Tarrant is a nurse practitioner who has owned and operated Manhattan house calls for the last 20 years. His practice offers home-based primary care, reducing hospitalizations and improving access to high-risk, high-cost patients throughout Manhattan. Dr. Tarrant is a clinical instructor for Rutgers University, former AANP, New York State Excellence Award winner, and the past president of the Nurse Practitioner Association, New York State in 2014. Welcome, Denis.
Thanks, Stephen. That's a mouthful. I appreciate it.
Yes, it's my pleasure. So welcome to our podcast. Our first question is, what was your healthcare journey?
It was a long one. It started 30 years ago. I guess we're going to go that far back. When I was 18 years of age, I'm in high school and needed to figure out what I wanted to do in college. Did some volunteer work at a hospital, really enjoyed and saw what the nurses were doing and thought, that sounds like a lot of fun. I was an 18-year-old kid. Wound up going right to nursing school from high school. From there, I started working at Lenox Hill Hospital, where back then in the 90s, they would actually reimburse education to go back to school. And I knew I wanted to go a little further with my education, more independence, and became a nurse practitioner, went to NYU, New York University. Back in 2001, I graduated there, started doing house calls by accident. A doctor friend of mine was doing home visits and house calls back then, wanted to go away on a honeymoon for a month and asked other doctors to cover his practice, and nobody wanted to cover a house call practice for 4 weeks. And so I was a nurse practitioner about 9 minutes, and he became, at that time, my collaborator, covered for him. He came back, and I said, this is something I really think I want to explore on my own, and started doing house calls on the side in the beginning. This is back in 2002. And so then the practice just grew organically out of the need and a very little capacity for providers to do house calls. And so since 2002, I went on to get my doctorate at Rutgers University, served my time with the Nurse Practitioner Association. I was the president in 2014 and was very active legislatively, as you know, just in terms of getting legislation approved across and improving the independence of the nurse practitioner role. And so in that time, the 20 years May will be 20 years from Manhattan house calls. And we'll have done about 50,000 home visits in that time. We have 2 nurse practitioners. We service about 700 homebound patients in Manhattan. And we have a chronic care management staff. And so it's been a very long road, starting back when I was 18 years of age. And that is sort of my journey to where I am today now of owning this practice. Teaching now at Rutgers University, the clinical instructor for DNP students there, DNP MSN students there.
Well, that's a remarkable journey, and you've been at this and you grew this from the ground up. So that's quite amazing work that you've done. Can you tell our listeners how you became involved in the NPA?
Yeah, it was, again, very organic back in, I want to say back in maybe 2005 or 2000, a long time ago. I wound up getting a fax or an email, a random email from Joy Elwell, who is with the Nurse Practitioner Association, very well. Went to a random meeting and saw what they were doing, really got involved in it, just started my own practice. So I kind of knew the hurdles that nurse practitioners were going through at a very early period. And I liked what they were saying, really liked and appreciated the message that they were getting across. And I became involved in the local chapter, in Manhattan Bronx chapter. And from there, started doing some leadership positions within the Manhattan Bronx chapter, became a board member of the NPA, and sort of grew from there and eventually into the presidency of 2014. But I know from a very early stage that they were doing very important work that directly impacted my own ability to practice independently, which I wouldn't really have understood unless I was on both sides of the fence.
What are some significant changes that you've seen in the nurse practitioner profession?
Oh man, when I first started, Stephen, back in 2002, people didn't know what a nurse practitioner was. They stopped listening after the word nurse. They didn't understand that we prescribe, we diagnose, we treat. Having to see patients and having to have that collaborating agreement with a physician was very onerous because I was new as it was. Doctors didn't know who I was. In order for me to practice, I had to have a physician that I would pay for money that I didn't have in order to have them collaborate for the practice. Physicians didn't know what to make of us. They didn't know how we were utilized, what collaboration meant, that it wasn't a supervisory role. A lot of legislative barriers in that time have gone through the changes. DNR. I needed to have a physician sign a DNR that had never met the patient before, but I wasn't allowed to do that. DME equipment, that was another thing that I had a lot of difficulty in getting for my patients, that I would have to run it through my collaborating physician. So a lot of things in the beginning was difficult because of requirement of the collaborating physician to sort of sign off on my work at the time. But it was really a lot of patient education and provider education as to who we are, what we do. And I think once they saw what I was doing, they were more comfortable with it. Today, I walk in now and people know exactly what a nurse practitioner is. And most of these folks that had been seeing a doctor in the office, the nurse practitioner has been their primary care provider to begin with. So there's a lot less education to the public about who we are and what we do. I can say in the last decade, the amount of information out there to the general public for a nurse practitioner is phenomenal, and really the practice is growing faster than I can even keep up with it.
So our last question is about the future of our profession, and you are faculty. So our last question is, what advice would you give soon-to-be graduates or recent graduates of the NP profession?
I think it's important to understand your worth. I think it's important to understand who you are, what you provide, and that you have every right to be in the primary care or associated field that you're going into, be it pediatrics, geriatrics, primary care, and that the future is now. That we don't consider where will this be in 5 years. The future is now, and primary care is becoming the nurse practitioner model. We do a great job. The statistics are now in our favor, and they really show that the quality of care that we provide is fantastic. So I do want these nurse practitioners coming out there to understand that you are going to be independent. You're going to be the future of primary care, and the country, literally, the primary care of the country rests on your shoulders as you come into the profession. You're bigger than you realize.
No pressure.
Yeah, but you'll be fine. You'll be fine.
No,
as long as you go to Rutgers, because I'll be teaching you. And then
that's great. Dr. Denis Tarrant, we appreciate your prior leadership in the Nurse Practitioner Association, for your trailblazing house calls practice, and for your faculty representation today, teaching the next generation of nurse practitioners. Thank you so much for being on the podcast show of the Nurse Practitioner Association New York State, and we hope to see you around soon.
Hey, always happy to be here. Thanks for having me, Stephen.
Thank you.